Okay, so I will say, y'all have biometric screenings here today. Is that right? In the back. If you have not gotten your screening yet, please go do that. That is super important. I'm a big advocate of people getting screened. I think Health Med is the vendor here today. They are some of the best in the business. I know those guys. So if you have not gotten your screening, please go do that. Hopefully, you personally won't need any of the programs that I'm going to review today, but you might. You might. And if you don't know your numbers, you're not going to know which program you would fall into. Okay. The other good thing about knowing your numbers, and whether it's your A1C, your blood sugar, your weight, your BMI, all these numbers that we throw at you, your blood pressure, it might be helpful for someone you know. And clearly, I want to go over this information today because we want to get it to members. So just be aware. Try to educate yourself on that, because then it helps you better educate members so they can get involved in the programs that I'm going to review today. So again, my name is Julie Sears. I work for Blue Cross Blue Shield of Alabama. I'm a clinical account consultant. So that's kind of a hodgepodge a job. I do a lot of different things for the people I work with in the building. I do a lot of other stuff for the groups that I partner with. So I scour data, I research, I try to help with kind of population management. I assess vendors, try to connect people to people, and today I'm going to try to connect people to programs. So again, just reminding you, educating again, because when it comes to educating people, repeat. We just have to keep going over the same information, because you never know when certain points are going to stick better than others. So we're going to review the programs today. We can have a lot of great information, but again, if your members or our members don't know about it, then we're not going to be able to have any type of impact on anybody. So again, I just want to reinforce what we're doing internally at Blue Cross. So the information today is kind of broad. It ranges from kind of a health and wellness standpoint to people that have more complex needs. So I'm going to go kind of from A to Z with the programs, depending, on the member, depending on what their needs are. It could just kind of set somebody up for success from a health standpoint. It could be something life-changing, or for some people, depending on their needs and the program that they enroll in, it could actually be life-saving. So again, just super important information. So we're going to start with the clinical program overview. So this kind of gives just a list of the programs that we have. But, one of the things that I want people to understand is that the programs that are listed on this particular slide, they're at no cost. So there's no reason not to be involved in them and to get members involved, because there's no extra cost where these programs are concerned. Again, depending on the person's health journey, they could be perfectly healthy, they could be somewhere in the middle, they could be somewhere on the extreme. We have a program that someone can plug into so they can maximize their health and hopefully reduce cost overall. So a lot of good resources embedded in each of these programs. But one thing that we forgot again, Michelle, was that last time I reviewed, before the programs, my Blue Cross account, once again, a slide. We forgot. We didn't do that slide last year because I kind of thought about it on the cuff. So I do need to get a slide up for that. But that is super important. How many in here today have a My Blue Cross account? Oh, okay, good job. Okay, I'm proud. Because guess what? I can look at all those numbers. We know which groups do good with that and which ones don't. So I can go in and pull that data and look to see, man, do we need to run a campaign for that? Do we need to get people, registered? So alabamablue.com, whether you go to the site, whether you have the app on your phone, it doesn't matter. The app is super convenient. I do recommend that because, wow, to have everything just right there when you need it, especially the virtual card. How many times have you needed your insurance number and you're like, oh, I got to dig through my wallet, or I don't have my wallet, but you have your phone. It's all embedded there. Register for people who have a contract and there are multiple people on the account. Every person has to do their own registration. A whole family can't register for my Blue Cross because everybody's needs are going to be different. Okay, so if there are a lot of people on a contract, everybody needs to go in and do their own Blue Cross account, so that is more personalized to that person. So again, that's super important for you guys to be registered, and it's super important to tell members to get registered as well. Let's see if there's anything else I want to tell you about that. Really, I think the great thing about I like it because I do like the virtual card access, but there are tons of tools on the app, on the site. It's great for reviewing claims, checking deductibles, finding a doctor, seeing announcements. There's just a lot of good resources on that, so be sure to register. So, of the core management programs, the first one I'm going to start with at the top is Blue Care. So Blue Care Advocacy, or we call it Blue Care Health Advocates. We kind of call it lots of different things within the walls of Blue Cross. The people that answer the phones for Blue Care are, gosh, they have so much knowledge. So they are basically like a health coach and an advisor all rolled into one. So you're getting a lot of bang for your buck when you call and a Blue Care advocate answers the phone. So they can help kind of navigate the healthcare system just right off the bat. A lot of times when people call in, they have billing questions, they have claims questions. These particular people that are answering the phone, they are very well versed in answering claims issues. So a good, starting point right there. But they can answer questions, explain benefits, resolve billing issues if needed. They can explain preventive services, get doctor's appointments set up for people, help people find doctors. They can also refer people into other programs, which is also good too. So Monday through Friday, somebody is going to be answering the phones basically from 7 a.m. to 6 p.m. This particular program, I would say, is for all members. This is for everybody that needs to call Blue Cross for anything, okay? This kind of a launching pad into the other programs that we have. Again, they're just great health advocates, and I think the key thing for them is, again, they're just very well versed in claims. So you can call with a claims question, and then they may divert into something healthcare related, and then you may get referred into a program, which would be great. The next slide says chronic condition management at the top, but really what I'm going to talk to is over to the right first. I'm going to talk about the at-risk health coaching first, because chronic condition is kind of an overarching umbrella, and at-risk health coaching falls underneath that because it's part of that kind of condition space, different conditions that somebody might have. The at-risk coaching program really does target, I don't say minor issues, but it is on the lesser scale from a health standpoint. So at-risk health coaching is going to be more geared to people who have been diagnosed with prediabetes, hypertension, or obesity. Those are the type of conditions, the people that have those conditions, this is a great, and that's all they have basically. This is a great program for them to get locked into. We know that prevention is key. Again, that's why I want people to go get that biometric screening, know your numbers, know what's going on. But these particular people, they do have something brewing. They have something that's kind of getting warmed up a little bit, and we don't want that to escalate and then the person ends up with a chronic condition, because then they will want to be in the chronic condition management program. We have great people there to help manage those people, but we want people to do something about it before they kind of boil over and get to that point. This particular program, the at-risk health program, coaching program, it really is the member's opportunity to kind of stop things in its tracks, okay, to reverse course and to, again, avoid that chronic condition. So the people within this space that are kind of running this program, very multidisciplinary team. You could have a respiratory therapist, an LPN, a dietitian, a pharmacist, a social worker, a diabetes educator. There are a lot of different people in this space helping our members. So it's a great team, and depending on the member's need, they can, refer within that group of the team that's in place. Say somebody needs more of a nutrition help, then they would be diverted to the dietitian. If they need something that's more pharmacy related, then the pharmacy person might be pulled in. So lots of great experience within the team running that health coaching program. the people that are the members that are in this program, they typically have some type of action plan. They have goals. We have a disease specific curriculum that they follow. So again, it's really about helping people make changes, make behavior changes, lifestyle changes. Again, we don't want them to end up in that chronic condition management program. But if they do, we have it. So that particular program is actually going to be, I don't say run by nurses, but the registered nurses are the people that members would be talking to. Now, again, if for some reason somebody needed specific help with something, they could also kind of divert and send that member to one of the people listed in that multidisciplinary team, a dietitian, a diabetes educator. Those people can always be pulled in to help a registered nurse, but the registered nurse would be the main person that the members would be having those one-on-one discussions with. And these are all phone, they're all telephonic calls that are happening with this. For chronic condition space, you can see the conditions that are listed there. In the past, we only had 5, and now we've grown to, I think there's like 7 listed there, so that's great. Some people with chronic conditions, they manage pretty well. They go to their appointments, they take their medications, they are trying to put good effort into making good changes. But some people just need a little more help. It's hard to follow a doctor's plan. It's hard sometimes to know what exactly is going on in your body, what is your risk. A lot of people have different barriers. So the nurses are in place to help people understand better and overcome that. At some point, the hope is that the nurse can educate the member to the point that they will be able to maintain and do what they need on their own without the nurse holding their hand. But, initially, if that's what's needed, then that's what they're there to do. Again, for all of these programs, we don't have anything on the table, I think, today, but we have a lot of different material related to these programs that I'm talking about today. So anytime you want, extra material because you want to have it on hand to hand out to members, just let us know because we can get you that information. Again, team of registered nurse for this particular program, basically 7 a.m. to 6 p.m. Monday through Friday. So again, it's just an awesome resource for all members. The next program that I'm going to talk about is case management. So this particular program kind of gets a little more elevated. So we kind of started with that Blue Care advocacy. That's kind of anybody, whether you're healthy or not. And then it kind of went up a little notch to the at-risk health coaching, because those are people that kind of have some minor things brewing that we want to tamp out. And then we did chronic condition, and now we're at case management. So case management, this particular program is going to proactively target people who have complex needs. They have complex problems. So these members could be going through something acute. It could be something chronic. The scenarios that fall within this particular program are very, very, the list is long, let's just say. So this could be someone that's been in a car wreck. Maybe they had an emergency surgery. Maybe they have chronic kidney disease. They could have a cancer. There are a lot of different conditions that can fall into this space. So again, kind of that, one-on-one, I don't say coaching with a registered nurse again, but this is a little different just because the touch from the nurse is going to be even more so than what somebody would have had with chronic conditions. So there's going to be a lot more contact in this space. A lot of it, again, it's kind of overlapping from program to program to program. Every program, we want to educate people on what their condition is, what their risk is. There's probably going to be some type of curriculum in place. There's going to be, help with barriers, appointments, medications. That's going to go on from program to program to program. That's not going to change. But again, with case management, it's just going to be a lot higher touch. I think the difference here too, because most people that are in this case management space that they need case managers, this is a very overwhelming time for a member and a family. And a lot of people do have a lot of barriers. There's just a lot of unknowns. So case management nurses really help navigate that member through the healthcare system because there's just so much going on and it's easy to forget. So I think, getting people plugged into this program it's a wonderful thing for the members, and it's a wonderful thing for the families. And the other great thing is that the case managers also work with the healthcare teams in the hospitals. So discharge planning, that's usually a little difficult to follow sometimes. So that would be one of the areas that the case manager would be able to help with as well. They're just great advocates all the way around. So I definitely think this program is one. They're all great programs. This is a great program. I think the wonderful thing about it too, within case management, you can see the specialty categories that are listed. We try to have nurses that have very diverse backgrounds, because that's going to be best for our members, because we want people that have actually worked in that space, because they understand that space better. So again, kind of an umbrella within, say, the oncology. I'm going to pull out that oncology space where it says specialty categories oncology. So for the cancer space, I don't say that can be a little bit different, but we have a new program. I say it's new. I think it's really been around maybe kind of quietly for about a year as it builds. And it is called Oncology Navigation. So that's a new program that I'm going to speak to today. If you take, again, case management, and then you've got all these different, specialties within it, oncology being one of them, the oncology navigation kind of falls under that. So with case management, those are registered nurses. The navigators that do oncology navigators, they aren't necessarily nurses. I don't say it could be lay people, but they could have, it's a social worker. They could have a varied background as well, but they typically are not going to be a registered nurse. So with this particular program, this is really for members that are no longer in that acute phase. They've moved from that acute phase, from whatever surgery, treatment, whatever has occurred, and they're a lot more stable at this point. So they just don't need as much assistance from an actual nurse, and that's why the navigator is a good person to transition to at that particular point. So again, they can assist members with appointments of all kinds. I think one of the great things is that, because clearly it's overwhelming, a cancer diagnosis is overwhelming, there's a lot of stress, they can help get them lined up with an EAP. They can kind of help monitor their stress levels, their anxiety, see how they're doing. They can review benefits, whether it's mental health, behavioral health. They can be a great resource for that to a member as well. If for some reason somebody's a high likelihood for recurrence, having a navigator staying on top of those medical needs is just super important, because they know what's going on with the patient. They know what's going on with their appointments, their medications, their scans. They have that global view of what's happening with the member. So because of that, if something starts to, again, kind of brew, they can help the member get to where they need. We want to prevent delays. We want to hopefully keep people out of the ER. When we do those types of things, not only is quality of life just better for a person, but we can also reduce costs. So that's a really important thing. Most of the referrals, look at that, I didn't switch the slide over. Most of the referrals for oncology navigation do happen within the case management oncology navigator space. So case management may be like, hey, this person's good, I'm going to refer to oncology navigation. And then maybe things start getting cranked back up 3 months, 6 months, a year down the road. The oncology navigator can then say, hey, I've got to send somebody back to case management. So it's kind of just a revolving door if needed. Other referrals can come from clearly the member. The member's like, hey, I want to be part of this. They can call. Again, case management, a primary care physician, a surgery, the oncologist. Referrals can come in basically any way for any of these programs. But clearly, we want members to advocate for themselves. We want you to advocate if somebody needs to be in a program. And I just found out we have one other program that just started, which I thought was very interesting. I just found this out last week, and this will be a same program is going to be in place for transplants. So that's going to be great, because again, a very tricky, complex space to navigate for members and families. So this will actually be duplicated for transplant patients. And I think, gosh, I wish I could remember now, when I found that information out last week, I think I don't say the engagement, I guess, for oncology navigation. I mean, we're touching like 50%. The percentage of people that are engaged with this particular program is really, really good. So that's a good thing for everybody. All right, so the next program is Baby Yourself, and I love all of our programs, but I really love this one because I used to sit beside these ladies, and I worked in labor and delivery for 10 years, so dealing with moms and babies, I just love that. So this gives me kind of a warm fuzzy when I go back to this one. Baby Yourself, another awesome program that we have within the walls of Blue Cross. It basically is just a proactive maternity management program. So we want babies to get great care. We want moms to get great care. We want good clinical outcomes. That is our focus. We just want healthy babies and healthy mamas. That's the whole point of this program. So this is not a replacement for members going to their doctor. Obviously, we want people to get set up with their OBGYNs, but we want people to get into this program as early as possible. So the earlier, the better. And I tell people, because, we've had things happen with members that weren't in Baby Yourself, and people are like, well, how do you know that Baby Yourself would have made a difference? And you could have maybe prevented that person from going into preterm labor, and then the baby would not have been in the NICU for, 2 weeks or 2 months. We don't know. So I just tell people it's better to be in the program than not to be in the program, because we may be able to help. There's no way to know that, but it's just better to be in the program than not be in the program. Either way, it's a great education. Moms oftentimes go to doctor's appointments and it's overwhelming, and you're in there and you're trying to get everything done and you forget to ask the doctor something. Well, call the Baby Yourself nurse. They will answer it for you. Or you may think of something once you leave the doctor's office. Call the Baby Yourself nurse. They will answer it for you. Or you might have a problem. Oh, my stomach hurts. I'm not sure if it's a contraction. There are a lot of different scenarios, again, that you might feel better, or the member just, quite frankly, might feel more comfortable talking to the nurse. So again, we want people to get in as quick as they can. First trimester is best if they can do that. One of the fun things that Baby Yourself does is give out gifts to the mom. So that's a nice little treat. They typically have, like I say, Stanley cups. I'm not exactly sure what it is now, but they have some type of thermos or water bottle. They have books, they have plush toys, and they have recently included a sleep sack. So not only do we want to, educate moms throughout the pregnancy on having and maintaining a great pregnancy, but we want to teach good, healthy sleep habits for them with the baby as well. A couple of different ways to enroll. They can call. They can apply online on alabamablue.com. They can download the Baby Yourself app, so that's good too. So again, another just wonderful resource within the walls of Blue Cross. So if you don't know about Blue 365, again, go to alabamablue.com. When you get to that site, if you will go, you'll see a tab at the top that says My Health. If you click on that, it'll drop down and it'll give you the option for Blue 365. Great deals for basically every aspect of your life. I'm so mad that I didn't look the other week because they literally had 20% off for Sonicare toothbrushes. And what did I do? I went out and paid full price for it, and dummy me could have gotten 20% off. So gym memberships, apparel, tennis shoes, you name it, Garmin watches, headphones, vision, travel, pets, home. It's got over 100 different discounts that you could get. So that's one of those things you need to kind of look at, maybe once a week just to see. But again, great deals for health and wellness and everything else for your life. If you have any other questions, I'm at the table. Come see me.